Thank you, Madam Chair. I'd like to thank you and Ranking Member Cole, as well as the subcommittee staff, for all of your hard work on this incredibly important bill. What I'd like to focus on is social determinants of health, the factors that are in all of our everyday lives that impact our health outcomes. In the congressional district that I serve, the community that lives in the 61605 zip code in the city of Peoria, it's a vibrant and a beautiful community filled with vibrant and beautiful people, but they face these challenges that in this zip code that is considered the most distressed zip code in America. The families there live in a food desert, which means they have problems finding fresh fruits and vegetables in their day-to-day lives. They lack many of the adequate transportation needs that are easy for the rest of us. And even though this community is one of the oldest in Peoria, many of its neighborhoods lack the basic amenities, like things like sidewalks, which allow their children to be able to walk to a neighbor's house, to be able to walk to go visit friends. So it's why I wanted to make sure that I fought to get $2 million in community project funding just for sidewalk installation in this zip code, and the upgrades that they need. And the committee and Madam Chair, you were nice enough and responsible and respectful enough to put that in the bill. So the struggles of this 61605 zip code that they face is, we see this in other communities, in rural and in urban communities, and it's way too common. So for far too long, there hasn't been that coordination to address these issues at the federal, state, and local level, and that's really been a disservice to our communities. It's really why I've been so proud that we've been able to work together over the past 2 years to be able to develop grant funding through the Centers for Disease Control and Prevention to address social determinants of health. This year's appropriation bill allocates $92 million in grants for social determinants of health. So our communities, whether they're rural towns or big cities, can have the tools at their disposal to be able to develop tailored programs to lift up their most vulnerable populations. This funding represents a critical investment in addressing health disparities, giving local communities the opportunities they need to grow and prosper. With that, Madam Chair, I yield back. Thank you.